Hennepin County health officials say they are working around the clock to try to reach anyone who could be impacted by the ongoing measles outbreak. 9 children in Hennepin County are confirmed to have measles. The cases are in unvaccinated children ages 1 through 4. Nina Moini reports 8 of the confirmed cases are in Somali Minnesotans.
We are working to identify the people who have had exposure, who are not immune, and to contact those folks.
It's all hands on deck for epidemiology manager Dave Johnson and his crew at Hennepin County Public Health.
What likely happened here is that someone came from abroad who was unvaccinated, was exposed to measles, and then brought that back to the United States.
Johnson says all the cases in Minnesota's recent history have originated from countries where measles is more common. He says questions surrounding autism and vaccines have also made an impact.
That misinformation happens in many different communities. What we're seeing now, though, unfortunately, is because of the fact that that has led to lower vaccination rates.
Executive Director of CARE Minnesota, Jaylani Hussein, says the Somali Minnesotan community has been dealing with higher rates of autism in children for years.
We are concerned of, obviously, the number of autistic children in the Somali community, and there's been some fears around that and rumors about the effects of vaccination.
A University of Minnesota report shows that in 2010, about 1 in 32 Somali children ages 7 to 9 was identified as having autism spectrum disorder in Minneapolis, a rate similar to white children but higher than other races. But no research has shown why.
The overwhelming scientific evidence shows us that there is no link between autism and the measles vaccine, and so we want that to be very clear.
The last measles outbreak in Hennepin County was in 2011. It can take up to 21 days from exposure for symptoms of measles to appear. So the county says the end of this outbreak will be 21 days after we've seen no new cases reported. And there were no new cases reported today, Amelia.
And what exactly are the rules for getting children vaccinated?
Right, so it's a little bit different depending on where you're from. When immigrants come into the country, they are required to get certain vaccinations, including for measles. But here in Minnesota, the parent of any baby born in the United States does have the right to object to childhood vaccinations and also for non-medical reasons.
All right. Thank you, Nina.